My name is Knut Dahl-Jørgensen. I'm a professor at the Oslo University Hospital in the pediatric department, and I'm principal investigator of the DIVID intervention trial, which we will release results here at ISPAD. We have performed research for many years searching for viruses as a possible cause of type 1 diabetes. Some years ago we performed tissue sampling from the pancreas in adult patients with newly diagnosed type 1 diabetes, and there we could detect low-grade enterovirus infections in the areas of the pancreas where insulin is produced. We could find both live viruses that were replicating, we could find the virus genome and also virus capsid proteins. So we feel quite confident that the viruses are there at the time of diagnosis of type 1 diabetes. And our next step has been to do an intervention trial, and this is what we have released for publication now in Nature Medicine. We did a randomized clinical trial comparing antiviral treatment with two different drugs, pleconazole and ribavirin, and compared that to placebo. We had 96 patients included, and they were treated in Oslo and also in Copenhagen, Denmark. They used the drugs for 6 months, and we followed them another 6 months. So after 1 year, we could see that the patient's own insulin production was better in the group that had the antiviral drugs than in the placebo group, and that was a significant difference. So we believe that is a strong case for saying that viruses are important for the etiology, as we say in medicine, of type 1 diabetes. So for the future, maybe it would be better perhaps to give such medication at an earlier stage of the disease process. So we now plan new studies to use such treatment perhaps to prevent diabetes type 1 to occur. If we could detect patients that have what we call autoantibodies in the blood, they say that they are going to have this type 1 diabetes with time. If we could start the treatment that early and see if it would prevent type 1 diabetes. These will be studies that we would like to perform perhaps in the next 1 to 3 years. But it will be long-term studies, so the results will not be there so fast. But we think also that these studies give some promise that one could perhaps develop vaccines against the enteroviruses that also could be given to try to prevent type 1 diabetes.